Okay, everyone. My clock says 2 o'clock Eastern Time, 11 a.m. Pacific, so I'm going to go ahead and get the webinar started. Welcome. Glad to see that we have a number of participants in the room on the webinar. My name is Christian Burgess. I'm Director of the Disaster Distress Helpline, which is a program of the U.S. Substance Abuse and Mental Health Services Administration administered by my parent company, the not-for-profit Vibrant Emotional Health. As many of you in the room likely know, Vibrant Emotional Health also administers the National Suicide Prevention Lifeline for SAMHSA, of which the DDH is considered a sub-network. And I'd also like to take a moment to introduce a few other colleagues that are joining us today in the room. One is Elizabeth Matashek. Elizabeth is our Contracts and QI Coordinator for the Lifeline and its sub-networks, and just joined our team last month. We're also being joined by Lydia Hernai. Lydia is our Best Practices Coordinator for Disaster Mental Health, focusing specifically on the Disaster Distress Helpline, but Lydia also works to support Lifeline Network centers that are located in or serving disaster-impacted areas through sharing best practices in disaster mental health with those centers. And we also have Tom Shukas in the room, who is the Lifeline Network Engagement Coordinator. I will be facilitating and doing most of the discussion during this webinar. However, Elizabeth, Lydia, and or Tom at some point may jump in if there are any questions relevant to their roles, or if I just need help in any way managing the chat room or any other logistics with the webinar. So that's who we are. It would be great to see who you are, who is in the room. So if you're hearing this, which you should be, take a moment to type in your name and title and agency, the crisis center that you're with, just so we get an idea of who's joining us today. That would be great. And I want to also just say that there might be some people who are on the audio line, on the conference line, but not in the webinar room. That's fine. You can just listen in if you're not in the webinar room itself, but I did send out, we did send out the link to the webinar in the meeting invitation that was sent out a couple of weeks ago by Tom and Elizabeth, and that was also shared in the Lifeline Weekly announcement, so hopefully you have that webinar link. But again, if you're just listening in for the audio, that's fine too. So why are we here today, and what are we going to talk about? Well, first of all, I'm going to go over some webinar logistics in just a few minutes. I'm going to talk a little bit about the background of the Disaster Distress Helpline project of SAMHSA and Vibrant Emotional Health. I'm going to very quickly skim through some of what's in the RFPs for the Disaster Distress Helpline call and text centers, the focus of this webinar today, which includes the roles of the centers, Vibrant Emotional Health, as well as what the requirements are for the RFP. But I'm going to quickly go through those sections because really what we want to get at in our time together today is to hear what questions you may have about the RFPs. All of you should have received the link to the downloadable RFPs that was included in the announcement that Elizabeth sent out last Tuesday, October 2nd. And this will be continued to be shared in the Lifeline Weekly e-newsletter that Tom sends out every Tuesday until before the deadline of October 29th. So you can also get the link to the RFPs there. Both the call and text RFPs are housed in the Lifeline Network Resource Center in the section for funding, and so you can download the RFPs there. And I've included them here in the webinar for those of you who, for any reason, haven't been able to access them yet in the Network Resource Center. If you look on the right of your screen, at the bottom right, there's a section that says Files, and all you have to do is hover over the file name, and then you should be able to navigate to where an option that says Download. And you click on you hover over the name of the file, You click on it, and then you'll get an option that says download files. So you can do that as well if you haven't downloaded it yet. But again, I'm really going to be, for the agenda of this webinar, I'm really going to be just skimming through the elements that are in the RFP because you have that information, and it would be redundant for me to focus on all of that for this short period of time that we have. So primarily what we'll be doing is taking your questions and providing answers during the webinar. The webinar, let me go to the logistics. The webinar is being recorded, and a link to the webinar will be sent out to the entire Lifeline network next Tuesday in the weekly announcements. For those that couldn't join us today, or if any of you who are on the call and in the webinar just wanted to go back over anything that we discussed, including if you wanted to take a bit more time on the slides that we're just going to skim through, you'll be able to do that. So that link will be sent out for the recording, will be sent out next Tuesday as a part of the Lifeline weekly announcements. So be on the lookout for that. In terms of the webinar itself, if for any reason you lose your audio connection or your visual webinar connection, all you have to do is call back in, log back in. You'll just pick up where you left off. If for any reason I lose my connection for the webinar or the audio, then we'll have to restart. But hopefully that won't happen. I haven't had any issues with these with this platform, this technology, in quite some time. But just so you know that if that happens, then we'll all just restart. But I don't think it will. In terms of audio, some of you may be calling in by both your computer and your phone. I recommend that if you are connected to the audio via both of a phone, a landline, and your computer, that you mute one of them so that we don't pick up any echoes if you have a question that you want to pose in the audio. But also in general, just keep your phone or computer or whatever it is that you're using to connect with the audio on mute over the next hour so that we don't pick up any background noise. That's very important. And if you're connected to us via a phone line, also don't put us on hold because we'll pick up any wait music that you might have. So we've all been on webinars where things like this have happened, and they can be highly disruptive. So again, just keep your phones or your computers on mute. And if you're using a phone, please don't put us on hold during the call. In terms of audio also, I really encourage folks that to use the chat feature on the right of your screen where folks are introducing themselves right now. The centers where they're located, titles, locations, etc. You see that going on the right of your screen. If you're just joining us, please take a moment to do that as well. Introduce yourself just to give us an idea of who's in the room. And also I encourage folks to utilize the chat feature to pose any questions that you'll have when we get to the Q&A because it's just a little more seamless to use the chat feature for questions than the audio because of those background noise and distortions and things like that. So I'll remind people of that when we get to the Q&A. And when we do get questions in, I'll ask Lydia and Elizabeth to help me field those and just sort through them when we get to the Q&A. So Lydia and Elizabeth, just be sure to be paying attention to all the activity going on in the chat box, if you don't mind. The webinar is also being, as you can see, we're providing closed captions for any crisis counselors who may be deaf or have hard of hearing or have any hearing disabilities where the closed caption feature might be assistive in helping them to get this information. And I've already talked about the supporting documents on the right side of the screen. And again, just really the bulk of this webinar is meant to take your questions about the RFPs and have a discussion at the end of the webinar. If you do come up with questions as I'm going along, you're welcome to post them in the box as we go along. But again, we won't get to them until the end. I'm not going to take questions throughout the webinar. I'm only going to save time at the end. And that includes if you have to jump off early for any reason, but you have a question. So if you know you have to jump off before we get to the Q&A, of course, go ahead and post any questions you may have, and we will get to them at the end, again, with support from my colleagues, Elizabeth and Lydia. All right, well, let's just jump into it. So the Disaster Distress Helpline began in 2011. It was created by SAMHSA in partnership with Vibrant Emotional Health after the Oil Spill Distress Helpline project, which started in 2010 and focused as a subnetwork of the Lifeline on the Gulf states that were impacted by the BP oil spill that occurred in April 2010. There were 8 crisis centers in that network in the 5 Gulf states, and SAMHSA created that to focus on the distress and other mental health concerns that residents of those Gulf states experienced as a result of the oil spill. And SAMHSA decided to use the infrastructure that was created to support the Oil Spill Distress Helpline to expand to the entire country and focusing on any natural or human-caused disaster. Thus began the Disaster Distress Helpline. We went live in 2012, and the project began right on the heels of a 10-year span of time where federally declared major disasters were increasing by 86% in that span of time from 2000 to 2010. It was a span of time with a lot of activity around the country in terms of disasters. And it was also so many years after the September 11th terrorist attacks. All these disasters combined spoke to the need to create a permanent network of crisis centers that were dedicated to supporting survivors, responders, and others experiencing distress or mental health concerns throughout the disaster cycle. It is a year-round service that operates 24/7, 365 with immediate crisis counseling and support no matter when someone might be experiencing distress. So immediately before a disaster occurs, during a disaster, in the short recovery, as well as the long-term recovery, so even years after a disaster. This was the intention behind creating the National Disaster Distress Helpline. And over the years since we began, many of you know that the need has continued to demonstrate itself. There were a record 242 major disasters in a single year in 2011. And in 2017, the disasters that we all know about and experienced, Hurricane Harvey, Irma, Maria, the major wildfires in California and mudslides, and there were also major floods earlier that year in Texas. All of those disasters added up to be the costliest in U.S. history. And we also saw a lot of major disasters in terms of human-caused events. In 2016, there was the Pulse nightclub shootings in Orlando, which at that time had been the largest mass shooting in modern U.S. history. But tragically, that record was shattered just a year later in Las Vegas when on October 11th, 2017, there was a mass shooting at the Country Music Festival there, and that became the largest mass shooting in U.S. history. This all points to that not only is there a need for the Disaster Distress Helpline, but the service is really meant to be comprehensive in terms of supporting survivors and responders throughout the disaster cycle for a wide range of events. It's natural and human caused, so natural involves, of course, earthquakes, hurricanes, tornadoes, floods, wildfires, and human caused, which is incidents of mass violence like mass shootings, as well as terrorism. Could also be transportation disasters, incidents of large-scale community unrest, like what we saw in Charlottesville and Ferguson, Missouri, and unfortunately happens all too often around the country as well. And there are distress implications when there are large incidents of community unrest. So we're also meant to be a service that provides support for anyone in the country following those types of events, and also with public health crises and emergencies. Is another reason why SAMHSA created the Disaster Distress Helpline, because of the distress implications around things like the Ebola outbreak that happened in 2015. And even though that was isolated, it's only a few cases, it was still, at that time, a widely unknown and distressing occurrence that was happening and impacting particular communities in the country, such as Dallas and New York City. So with all of these types of disasters, we know the research supports that the vast majority of people are going to experience temporary distress reactions, minimal to moderate reactions, and 23 to 17% are going to experience severe to very severe reactions such as depression, persistent anxiety, substance abuse, or perhaps even suicidal ideation, particularly during the long-term recovery. And this is also behind why we have the Disaster Distress Helpline, to provide support to people who are experiencing temporary distress reactions so that they can move forward on the path of recovery, but also to provide support to people who might be experiencing more severe reactions, which might involve crisis assessment, intervention, and referral, but also will help connect them to behavioral health resources in their community for follow-up care and support, such as their local Lifeline Network Crisis Center and other services that might also spring up in the aftermath of disasters, like FEMA-funded crisis counseling programs. So this is why we have the Disaster Distress Helpline. As I mentioned a moment ago, our goal is to provide 24/7 counseling and emotional support to anyone in the United States and territories. We also serve Puerto Rico, the U.S. Virgin Islands, Guam, American Samoa, and the Northern Mariana Islands. Experiencing distress or any mental health concerns related to natural or human-caused disasters in order to help them move forward on the path of recovery. Our two core services, and which constitute the two RFPs that we're issuing to the Lifeline Network, are a 24/7 hotline service as well as a 24/7 texting service, the information for both of which you see there. Our grant cycle, which this RFP is for a 3-year funding cycle. So the awards that will be given out through this RFP process will be for 3 years through September 30th, 2021. I'll talk a little bit more about the timeline in just a few moments, but that's the timeline for the grant itself. It just began on October 18th. As I mentioned, it's administered by Vibrant Emotional Health as a subnet, and we're a subnetwork of the National Suicide Prevention Lifeline, which is why we go through the Lifeline to also form the network for the Disaster Distress Helpline. And we talk about this more in the RFP, and I think most of your centers are familiar with why we do this. It's because Lifeline centers are uniquely equipped to form the network for the Disaster Distress Helpline. You bring with you not only the accreditation and the adherence to standards, trainings, and practices that are required to be a part of the Lifeline network, but crisis centers are resources that people typically turn to in times of disaster in their community. Your centers already do provide emotional support and crisis counseling throughout the disaster cycle, and so we want to build on that local or statewide expertise that you provide so that you can be positioned to help anyone in the country throughout the disaster cycle as a part of this sub-network. So the grants that we're administering will support 3 call centers. We have 3 awards available to form our call center network, and we have 2 awards available to support our tech center network among eligible Lifeline centers and via, again, this competitive RFP process. Again, I know I'm going through some of these quickly, so if you have questions or need me to go back over anything, a lot of this information is explained in further detail in the RFPs itself, but if you want to pose a question here, you'll be able to do so. In terms of the overview, I wanted to spend a bit of time on our call and text volume trends because I know that's probably front and center on your minds. Starting with call volume. So the chart you're looking at here, I'm going back to the year 2014-2015 federal cycle, and the timeline that you see here is based on the federal fiscal cycle, so October through September. And you see some interesting trends here. In 2014-2015, our volume was fairly steady. We were averaging around 300 calls or so a month, with a little bit of peaks and valleys there. And then in 2016, 2017, of course, you see that huge spike towards the end of the federal cycle, starting in August and significantly escalating in September. And then you see that a little bit too in October in the green line there too. That, of course, was because of the major disasters that occurred last year that were all back-to-back, historic, and the Disaster Distress Helpline, similar to other services, that operate hotlines like FEMA and the American Red Cross, we all saw record call volume following those major disaster events. The spike with the Disaster Distress Helpline in September of 2017 was also attributed to kind of an anomaly, which is one of the reasons why it's so stark there in that chart. The American Red Cross, who we have a partnership with, and we have worked very closely with their disaster mental health program, they sent out a text blast to people who had subscribed to their text support service through Hurricane Harvey specifically, and towards the end of September, or middle September, they sent out a text blast to these users who were subscribed to this. Their intent was to share resources because people were experiencing such long waits with hearing back from the American Red Cross with the cases they had set up with the American Red Cross chapters in Texas with Harvey. And so their intent was to share resources. However, unfortunately, when they shared the Disaster Distress Helpline resource, a lot of their users thought that that was a program of the American Red Cross. And so as soon as that text blast went out, we saw a dramatic spike. So it was an anomaly. It was stressful for our crisis centers at the time, our call centers. And they worked really hard at clearing the lines and clarifying to the users the discrepancy. We quickly worked with our partners at American Red Cross to prevent that from happening again, and thus you don't see a similar spike anywhere there. But the thing is, I mean, I think an important thing also, and some of you may wonder, is that it could happen again. I mean, as much as we work to control things like this through our outreach with groups like the American Red Cross, sometimes all it takes is one errant text blast like that, or some other means where the information about the Disaster Distress Helpline gets out there, and it can result in some sudden spike like that. It truly is, thus far in our service, it truly is an anomaly. We've never experienced anything like that before. We haven't in the years since. And when things like that do occur, Vibrant Emotional Health, our Disaster Distress Helpline staff, including myself and Lydia, we work very assiduously and quickly to address the issue and try to get to the root of it and hopefully to prevent it from occurring again. So I want to explain that, a bit of an anomaly. Our volume in the past year is also higher than average, largely because of the sustained volume from the recovery of Harvey, Irma, and Maria in particular. But then you also see that trend, it's the yellow line there on the screen, of calls starting to creep up again in September, and then you see it really high in October as well so far, and that's because of Hurricane Florence, which is a pretty major disaster as well in North Carolina. We think at this point that the yellow line there is going to be sort of a new normal for us, that we're going to, and this is what we're projecting for the 2018-2019 year, is that our volume will be very similar to the 2017-2018 cycle. We might end the year with about 11,000 calls, and which means that we average about 900 calls per month, which breaks down to 300 calls per center, because remember, it's 3 call centers in this network. So I'm hoping that this gives you an idea of what kind of volume you can expect with the Disaster Distress Helpline for call centers. This is call centers only. And in terms of some other trends, our volume in terms of the heaviest day and time is very similar to what we know happens with the Lifeline. Most of our calls with the Disaster Distress Helpline happen on Mondays between 10 a.m. 4 p.m. Eastern Time. And most of our calls throughout the rest of the week tend to happen during sort of the business day. We don't get as many calls later in the day or overnight with the Disaster Distress Helpline. But, you know, it is, again, it's a 24/7 service, and so it is staffed at all hours accordingly, but that is when we see our highest volume. That's our trends. And what we're certainly seeing now that we're 6 years into the project is that our overall monthly volume tends to be highest during hurricane season. in July, August, September, and October. And I've been with the project since the start, and I can say that of all disaster types, that it really is the most common type of disaster that seems to trigger the highest amounts of vicarious distress and distress in impacted areas are hurricanes. Hurricanes have a slow build-up to them that can produce a lot of feelings of dread and anxiety. In people in the impacted areas, they tend to impact large areas at the same time, multi-state regions. They tend to produce many types of disasters in one disaster, such as flooding and tornadoes. It doesn't mean that we don't get calls with other disaster types. We certainly do. We see calls with wildfires and tornadoes, and we certainly see smaller spikes when there are mass shootings as well. But those trends tend to be more time-specific, so once that disaster is occurring, they spike, but then they quickly go back down to what it was like before that disaster event. Whereas hurricanes, we tend to see an increase, and the increase we tend to see sustained over a period of time, more throughout the recovery. So those are some of the trends we're seeing with call volume. I want to move on to talk, and again, if you have any questions specific about our trends with call volume and some of our numbers, you can ask it. With text, so our chart here is a little more kind of a roller coaster versus our calls, but similar in some ways too. Similar to for call volume, our text volume in 2016-2017, so FY17, October 1st, 2016 through September 30th, 2017, was also the single year we saw the most text volume, which was 18,168 total texts. That is the overall text volume. That is not the number of users. We average about 11 to 13 text users per session. Let me explain that again. We average around each user texter to the Disaster Distress Helpline sends approximately 11 to 13 texts total in one session. So that all adds up to that overall volume. So that total for the 2016-2017 year represents about 1,400 text sessions. So let me break down that a little further. So in September of 2017, similar to our call volume and related to Harvey, Irma, Maria, we also saw our highest amount of average text sessions that month, which was 629. In FY17, which actually was before these disaster events, we saw 3 months where we had higher than average volume, which is why you see that green spike there in April, May, and June. We don't exactly know why that is because it was hard to tie that into a specific disaster, but it was likely because of just ways that we were promoting the texting service or trends that are hard to isolate otherwise with why users were picking up on our texting service over those 3 months versus what they normally do. And by the way, as those of you who have crisis centers that operate texting services also know that even though I'm saying that the average texter sends about 11 to 13 texts, that can also vary greatly per text session. I mean, some texters may send 2 dozen or more texts, and we do get repeat users with our texting service just like we get repeat callers. So sometimes that also impacts our volume. Our average monthly text volume for the year we just closed out on September 30th, 2018, we averaged about 150 sessions per month, which broke down to about 75 text sessions per center, and remember we have 2 text centers in our network. And again, similar to call volume, we think this is going to be, we're projecting that these will be the trends for FY19 as well, is that we'll see about 150 sessions per month, which translates to about 75 per text center. Which, again, if you further break that down, that's about 2 to 3 text sessions per day. That doesn't mean that that's 2 or 3 brief text sessions. those text sessions could be 30 minutes or longer. So it's a little misleading when we look at numbers like that in terms of the time and effort required, but hopefully that will give those of you who are interested in applying for the Tech Center RFPs an idea of the volume. In terms of our text volume and looking at our trends, we tend to get more texts that come in early morning, late night, so between the hours of 10 p.m. and 1 a.m. Eastern Time, except Mondays, when our text volume also tends to be heavier during the day, and our trends indicate that we tend to get more text sessions on Mondays between 1 and 7 p.m. Eastern Time. So I don't know if those of you who operate other text services see other similar trends. I understand that with the Lifeline chat service that also tends to be heavier late at night, early morning, in the overnight hours, but that's a trend that we see with our texting service as well. So that's some insight into our text and call volume. So let me continue to move forward because, again, I really want to get to questions that you may have. So roles of DDH call and text centers, nothing to highlight here, except, and this is going to be a recurring theme, is that we really want call and text centers in the DDH network to think about surge staffing before, during, and in the aftermath of major natural and human-caused disasters. 6 years into the service, this is something that we as administrators at Vibrant Emotional Health are also increasingly paying attention to. And in the role of Vibrant Emotional Health, that's something that, looking forward to this new grant cycle, we actually want to do more hands-on work with our call and text centers to just try to do a better job at assisting centers with anticipating what kind of staffing patterns they may need in order to accommodate surges. So when we hear of a hurricane or in the immediate aftermath of an incident of mass violence, something like that, we can do a better job at helping centers understand what the staffing demands might be, and sort of look into any kind of staff forecasting that we might be able to do as well. But that's something that we want you to think about in your applications. I'll talk about this too, but I mean, some of the sections in your application might be redundant, which I'm sure you're all familiar with other applications. But it's just that's something that you see in particular that's a repeat theme is the idea of surge staffing, because we do want to minimize dropped calls and long wait times, which can happen in the aftermath of disasters. But we're just sort of wanting to really focus on how can we accommodate surge staffing while also working to have strong answer rates and short wait times. And I know that many of you also have a lot of experience with surge staffing, not only with disasters that occur in your communities, but also with surges that occur on your crisis lines in the aftermath of high-profile deaths by suicide. So it's a very similar concept that we're looking at here. And so in your applications, we want to hear about what you've done with surge staffing and what you think you need to continue to do to improve your ability to accommodate surge staffing. I don't know that there's anything else I need to really emphasize here, so I'm just going to move on. But again, if you have questions about the roles, please ask them in the Q&A. Change to the RFPs this cycle is that we're not calling our centers core region centers any longer. When we began the Disaster Distress Helpline in 2012, we actually started with a region-based routing model where calls in particular regions were routed to a particular center. But what we learned that first year is that, guess what? We can't predict disasters. And it happened that the first year of our full funding cycle in 2012-2013, there was Hurricane Sandy, there was the shootings in Newtown, Connecticut at Sandy Hook Elementary, there was the Boston Marathon bombing, all of which occurred in the same region, and our center that was in that region at the time received a much higher level of call volume than our other centers. And so we actually moved to a round-robin routing model to distribute our call and text volume equally because ultimately we have the same standard of care that we provide to any caller and texter, which is in the RFP that we talk about with our core training requirements. And we're not a granular local service. We're providing disaster crisis counseling and emotional support to anyone around the country, whether it's Alaska or Georgia or Iowa. We are providing local resources for follow-up care and support, which may include the local 211 information referral service if the person is looking for any kind of concrete services related to disaster. It may be to their nearest Lifeline crisis center. But ultimately, our primary intervention is supportive counseling and emotional support, which we do regardless of where the person is calling from. And so we have a round-robin model, and that also assists us with surge capacity for calls and text. And this year, we're taking applications from anywhere in the country. We're not dividing our network by region because there's really no reason why we couldn't have, say, 2 centers, one in California or one in Montana, or a center in Texas and a center in Illinois. And before, we had those sort of blocked into the same regions, and therefore we would only accept one center from those regions. But we're trying to take a more holistic view of the network at this point in our project, and just ease some of the competitive nature of it a little bit, at least to the extent that we can. With that said, with the final applications, among those with the highest scores, we may need to take in geography, because if it happens that 2 of our highest scoring applicants are within a very close proximity in the same state or the same region, we may have to look at the next highest scoring applicant in that, because in the event of a major disaster that might take out both of those centers, not to sound so too doomsday-ish, but we don't want that to disrupt our own continuity of operations with the disaster distress helpline. So hopefully that makes sense, but again, if it doesn't, you can ask the question. These are our core training requirements. We ask that all centers in the DDH call and text network accommodate the National Child Traumatic Stress Network psychological first aid, and we have our own core curriculum that we supplement with that, which we call Just-in-Time Supportive Disaster Crisis Counseling for Crisis Contact Centers. It's a web-based or webinar-based modular training. We're currently in the process of updating it, which will be ready for this new network configuration, or the next cycle, I should say. And both of these are meant to be easily accommodated in a 24/7 crisis center environment. You can start and stop all the trainings. And we supplement these trainings as well year-round with disaster-specific, just-in-time training and resource alerts, so that crisis counselors are aware when a major disaster is occurring that they may be getting calls and texts in relation to. Those are just sent out via email and distributed in our network centers for crisis counselors. Those have refreshers on key points of our training, as well as disaster-specific resources that callers and texters may be looking for in relation to a particular disaster. And I should say, too, that the idea of the just-in-time is to apply principles of PFA to a call and text setting. So it's basically combining PFA and with standard elements of a call or text session. And so we have both of those trainings. PFA is still considered one of the gold standards in disaster behavioral health. It's widely used by not only mental health professionals in disaster trauma, but also other disaster preparedness, response, and recovery organizations. So it's one of the reasons why we still have it as one of our core trainings. There are some roles with vibrant emotional health. Not going to spend any time here, but you have this in your RFP, and so you can review it and ask questions. In terms of eligibility, nothing new here. You have to be a part of the Lifeline network. We want some experience with the Lifeline network, so we want centers that have been in the network for at least 6 months prior to the deadline for the applications. We want centers that can demonstrate that they have the capacity to be a part of the Disaster Distress Helpline network, which is why we have those volume and answer rate requirements. And again, if you have any questions about those, you can ask them in the Q&A. Some other eligibility requirements. One of the key ones here, which folks might have a question about, is that in the RFP it states that we require at least 2 DDH call centers and 1 text center to be able to provide 24/7 live Spanish-speaking counseling, which might seem to significantly narrow the field, and I understand that in effect it does. A part of our grant requires that we offer 24/7 live crisis counseling in Spanish, and in our experience, we can't do that with just 1 center. We need redundancy built into our Spanish hotline option, so it helps that we have 2 centers in case one has to go offline. And as you might expect, following the disasters last year, which impacted areas that had a high number of monolingual Spanish-speaking individuals and families in Texas, Florida, Puerto Rico, we had higher than average Spanish call volume. I don't have those numbers right on me, apologies, but I want to say that we ended the year with about 1,200, it might have been higher, Spanish language calls total for the year. So that was about 100 per month, which means about 50 per center in our 2 Spanish language call center routing model. And those are also routed round robin between those 2 centers. In the event that we only get 1 applicant that has 24/7 live Spanish-speaking abilities for crisis counselors, or if we have applicants that score higher, much higher, and they don't offer that, it's something that we'll take into account in our final decision, but it's still something that we're putting out there from the get-go because it's the most efficient way for us to administer the Spanish language option for the disaster distress helpline. The text center is less concerning because we get very few Spanish language texts. I want to say we ended the year with maybe a couple dozen, and that might be too high a number. We're still compiling all of our metrics from the end of the year, but that just ended on September 30th. But it's very low, our Spanish language text, and so that's not as major of a requirement. But we still want at least one of our text centers to also have 24/7 Spanish speaking capabilities for the reasons I mentioned, because we do offer 24/7 live texting option for Spanish speakers. But again, if there aren't any applicants that offer 24/7 Spanish speaking for text, or we only get 1 or not, we'll take a look at that in the final decision process with our independent reviewers when it comes down to it. So hopefully that all makes sense with language, but again, post your questions if not. I want to talk, I'm determined to get at least to the 15-minute mark for question and answers. So I'm going to say also with the DDH text centers, you might have noticed in the RFP one thing in particular that we asked prospective text center applicants to put in a statement. I know that sounds kind of trite, just acknowledging your center's willingness or hesitation to participate in exploring new opportunities for engaging disaster survivors and responders via online technologies. So this is a specific pilot program that we're looking to implement early next year, which we're calling Disaster Peer Support Groups on Facebook. The idea is that these will be monitored Facebook groups for survivors of a particular type of disaster event. Right now, and this is all subject to change, we're exploring starting with survivors of mass shootings. There are many of these groups online, but they're almost always informal and not monitored. And in trying to meet survivors and responders where they are, we're exploring with SAMHSA and Facebook the idea of creating monitored groups where people are recruited, or I shouldn't say recruited, but promoted. The groups are promoted among peer survivor networks, and they're screened to join, but that when they're in the groups, they're providing peer support to one another, but that support is monitored by crisis counselors for any potentially inappropriate activity or for any activity in the group that might indicate a person is experiencing acute distress or crisis and therefore may benefit from immediate follow-up support. This is all in development, but we're wanting to partner with our tech centers in particular in this pilot because of the expertise that texting and the similarities that texting has with online technologies like social media platforms. There may be additional funding in relation to this pilot. And so it's not that it's going to be a part of your regular stipend, but that's something I want to make sure that people understand as well. If in the application you have concerns as a prospective DDH Tech Center about also taking on this pilot, you can put that in your application. This statement, whether it's a willingness or a hesitation, will not be scored as a part of the application. The reason why we're putting it in there to begin with is because we just want to be transparent about our goals for this pilot program that, again, we're hoping to launch in early 2019. And pending the results of the pilot and additional funding, if it becomes permanent, then again, we'll look at either continuing the partnership with our DDH Tech Centers, or it may become a separate RFP all in and of itself. So that's all to be determined. The other thing I want to say about texting is that currently we use a third-party vendor called Mozio for hosting our DDH Techs. There is no additional cost to the center. DDH Tech Centers, we provide them access through secure usernames and passwords to access the web-based platform for receiving and responding to text. We train you in the Mozio platform. We've been using Mozio for 6 years. We took it over from the oil spill distress helpline. We're looking at this new grant cycle as hosting a competitive bidding process to assess the viability of alternate texting platforms moving forward in this grant cycle, because we need to, as an administrator, and just to make sure that we're on top of best practices with texting technologies in particular, which have come a long way since 2012, we need to just make sure we're providing the best service, not only to texters, but also to our crisis center partners. And so the DDH Tech Centers that will be awarded the 2 grants will also be a part of that process, because we want you to have a voice in who this vendor is. That would be a timed out process. Obviously, if we were to go with a new vendor, we would phase it in over time, because we would also have to rebrand all of our information and materials, and et cetera. But I wanted to put that out there as well. Because I want to get to questions, nothing else I am going over here in the rest of the slides is new information or anything that I have to emphasize in particular. It's all in the RFP, the evaluation criteria, what each section involves. And remember, I already talked about the elements of surge staffing and related to continuity of operations planning that you're going to see in the application requirements. So I'm not going to spend more time on that here. The deadline for the applications is October 29th, close of business Eastern Time. Our goal is to get the reviews from independent reviewers started shortly thereafter, with a decision made the week of December 3rd and announcements made that week, so that we have a month of training and onboarding any new centers, and with an implementation date of any new centers on January 7th, because we need some time after the holiday season, both with our vendors in terms of any routing changes that we have to make, as well as just with your centers, because you likely would have staff on vacation, et cetera. The requirements of the application continued. We will be giving bonus points again this cycle for current or previous providers. It might be a center that was in the network before, but is looking to reapply. We want to reward good behavior. That's why we have that. It's essentially what that boils down to. And just to say a bit about that too, is that sometimes this might prevent a new center from applying. We've changed our network in the past. I mean, your center has, if it's interested in this project, I encourage you to apply, because even though prior centers or existing centers get those 5 bonus points, if they meet the requirements in them, it doesn't preclude your center from having a high score in the application process and therefore being considered for one of the award grants for calls and texts. Budget justification, you can provide supporting documentation. as outlined there. I think I've gone over all these points. Award notices, etc. Due date and questions. The questions in this webinar and that you might submit offline through email will be posted, compiled and posted on the Lifeline Network Resource Center at least 2 or 3 times before the deadline. So now, let's get to some questions. So Elizabeth and Lydia, help me backtrack with any chat questions we have. I'm going to just, not in any particular order. It says, will these be dedicated lines? I think that question, for the hotline, I think the answer, if I'm understanding the question correctly, is yes. In order to get DDH calls routed to your center, we ask for a dedicated termination line so that when the calls come through, they're easily identifiable by your crisis counselors so that they can answer the call appropriately for disaster distress helpline, and so that we can collect separate metrics, et cetera, associated with that. So I hope that's the intent of your question for that one, but if not, then just post a comment for clarification. Another question is, can any crisis center use the training programs even if not part of the disaster response program? The NCTSN PFA online training, the web link for which I included in that slide, so on the recording you can go back and get that link. Yes, because it is public facing and it's free. It's accessible to anyone. You just create an account, a free account, and you can take the training. The just-in-time trainings that we administer, the short answer is no. Currently we don't make those available to just any center. The exception being that if your center is located in or serving a major disaster-impacted area, we can work with you on getting our training. We've done that through our Affected Area Center Grant Initiative, which some of you may have applied for and gotten small grants for, because the grants help pay for training in our just-in-time. It helps pay for the staff time and effort. But we don't widely disseminate our just-in-time training because we want to make sure that we're keeping the focus of that to our network, because that's going to be the most efficient, effective way for us to also just continually monitor its performance, its effectiveness. And in the coming cycle, we also hope to do more evaluation of the effectiveness of our training, because it's one thing to measure answer rates and wait times. It's another to measure how effectively and efficiently are we serving our callers and texters. So we're wanting to do more evaluation measures of the curriculum itself once we implement our updated curriculum. That probably won't happen until the next funding cycle, the next fiscal cycle, the 2019-2020 year, but that is something we're looking towards. A question, what software will be utilized? I'm not sure what, Elizabeth, I'm not sure if you can clarify what that's in reference to.
If you're talking about documentation software for the calls, in which case it would be whichever documentation system you're currently using?
Yes. So that is the answer, is that we don't have any database or any kind of metrics collecting software that we ask centers to use specifically. We ask centers in our network to use what they have, but to accommodate what our needs are. So whether it's the monthly call and text scenario reports that you send in, which is a SurveyMonkey link for us. I mean, that's pretty simple, but you get those based on your own call or text documentation records and software that you use. Same for when we send you resources in our just-in-time disaster alerts, we ask that you upload those to your own INR database. So there's no central referral system or data collection system that we ask our network to log into separate than what you use. We want you to use your own systems to accommodate those in particular. So hopefully that answers that question. What is the what is the average speed of answer and abandonment rate? Lydia, I don't know if you have the latest for Q3 of this year handy. I want to say that we're right at what we ask for a minimum, at about 80% of answers called in 2 minutes or less. Obviously, we're always striving for higher than that, but we also recognize the demands, especially with capacity challenges with Lifeline, with all your other services, and with surge calls and disasters and texts. We're actually, our moving into the new grant cycle, our minimum standard is going to continue to be that we ask center, at least for now, is going to be to ask centers to strive towards answering 80% of their DDH calls in 2 minutes or less. With texts, we actually don't have a standard yet. We know that with text, the sooner you respond to the first text that comes in, the more likely you are to maintain engagement. So we don't want an hour to go by before you respond to your first text. But we're still working on establishing a true standard for response time with text. With calls, that's what we have. We may change that, but we're also looking at really seeing the fluidity with answer rates and wait times when it comes to times of disaster, and seeing if there might be different standards for sort of blue skies when volume tends to be lower versus gray skies when we're getting more and more calls and texts in a short period of time, and therefore we might need to have more flexibility with our answer rates and wait times. So hopefully that answers that. But we're recording all of these for the general Q&A, and we'll provide a more detailed answer in the FAQ for that question. Do chats count for the 80% answer rate? It's a good question. I need to look and see. So we'll follow up with that question as well. I don't have an answer to that right now because I don't know what we've outlined in the RFP right offhand. I think we do say something about other services for that, but I need to circle back with Elizabeth and our QI team to see that. Will this be a 3-center call expansion or 3 new call centers? This is going to be 3 call centers, period, whether they're new or centers that are in the network and that are reapplying. So we don't consider it an expansion. We consider it a continuation. And then I see another question, can existing Lifeline centers that have provisional membership apply? I think the answer to that is no, but it's a good question. I need to circle back with our QI and team, and again, we'll post that in the formal FAQ in response to this webinar, because we need centers to have. Yeah, go ahead.
Oh, so sorry, I can answer that. Unfortunately, at this time, centers with provisional membership cannot apply.
Yeah. That's why I was thinking the answer was no, because we need to make sure that you have your accreditation in place and all the other onboarding requirements to be a part of the subnetwork. Will there be a means to obtain call metrics that are not collected from the database system used by the call center? I'm not sure I understand that one. Will there be a means to obtain call metrics? We're going to have to think about that one and post that in the FAQ and follow up to the webinar, because I'm not exactly sure what that means. Let me go to the next question. Will some of the funding be allocated for indirect costs? Yes, you can apply the quarterly stipends of $12,500. You can include in that your indirect cost rate, your standard indirect cost rate. I believe that's also outlined in the RFP, but if not, we'll post it in the FAQ to clarify that. Want to make sure we only have a couple of minutes here. Elizabeth, I think you're fielding some questions for me, and Lydia, if you pick up on any too, let me know. Is there anybody that's only on audio and not in the webinar that wanted to unmute and ask a question? So Eric is asking, Eric, that's a good question. To be honest, I don't have an answer. It's as a subnetwork and as a service that's still relatively new compared to Lifeline and other services that have been around longer. We're kind of always refining our reporting process, and we collect our metrics on a quarterly basis from our crisis centers and then compile them, and so we'll answer that question more fully and roundly and get back to you and post it in the FAQ. Other questions before we round up here. I want to encourage you to learn more about us if you're interested in applying at disasterdistress.samhsa, that's samhsa.gov, disasterdistress.samhsa.gov. Follow us on Twitter or like us on Facebook. All the information is there on this screen. And thank you for participating. We know that that funding opportunities like this are really important to our network. We want to make the process as transparent and fair as possible, so please let us know if you do have any questions or concerns. And again, we just want to emphasize that we really appreciate any center that applies, whether you're former, existing, new, because the service itself is working to support everyone around the country that's struggling after natural and human-caused disasters. We hear from our partners at FEMA, at American Red Cross, and other voluntary organizations active in disaster that the Disaster Distress Helpline 6 years into the project has become an essential resource that they promote in their field-based operations. We're a relatively low call volume but high capacity service when compared to Lifeline, but we're an essential service. And we've really worked to build that up over the past 6 years and become an essential part of the federal disaster preparedness response and recovery framework for FEMA's emergency support function 8, which is mass care, and their recovery support function, health and social services. We're embedded into these plans at the federal level. And so by applying, and eventually those of you who will be awarded the grants, by being a part of this network, you're a part of this essential service around the country. For any questions follow-up questions you may have, if we didn't get to your particular question, and again, those that were posted that I couldn't answer now, or that we need to explain more fully, we will be posting these in an FAQ that will be posted on the Network Resource Center and distributed, a link to it distributed in the network announcements over the next couple of weeks. If you have any specific questions that we didn't get to today, or if you're listening to this on the recording and you want to send them, please email Elizabeth Matashek at EMATOUSHEK@vibrant.org. That's VIBRANT.org. ematashek@vibrant.org. And we will, any questions that we also get by email or by phone, we'll also be compiling in the FAQ and posting to the Network Resource Center so that everyone is aware of the questions being asked and the answers posed. So I want to thank everybody for your time today, and we'll be distributing this recording shortly. And thanks, and have a great day. Ending the webinar.